I'm Dr. Wang from Taiwan. It is my honor to share our care experience for the aging population with COVID-19. Today's talk will be focused on the frailty and dementia elderly. Since 2017, Taiwan has started the long-term care project 2.0. People with frailty, cognitive impairment, and disability were transferred to community service units. And this inconvenient would receive home-based medical care from the hospitals. And care managers will frequently visit the client for their needs. At the community units, we have different services for the elderly and the caregivers. We have safety guard for disability. We have family caregiver support group. We have family caregiver training program, as well as daycare center for moderate dementia and disability patients in the daytime. And we have different kinds of multimodality programs to prevent frailty, cognitive enhancement, and to delay disability. The elderly were intimate interaction at the community units then. They were happy and happiness. Till this May, contrast to the global rapid outbreaks, Taiwan had only a few sporadic cases, and the vaccination rate in Taiwan is very, very low, just 0.47 per 100 people. And the epidemic alert is just at level 1. So the community unit is open as usual, and we took the initiative in the community units to teach the elderly the correct concept of epidemic prevention, washing hands, wearing a mask, and keeping social distances. Unfortunately, on May 11, 2021, Taiwan had an outbreak of community infection. The confirmed cases rapidly increased up to 13,000 in a few weeks, and the epidemic alert soon upgraded to level 2 and to level 3 in few weeks. During the level 3 epidemic alert, the community units, home-based medical care, and care managers' visit were suspended. It comes to all too soon, so that we must take some quick responses for the elderly. We started the telecare for OPD visiting and home-based medical care. You can immediately enter a one-to-one online consultation room after showing your health insurance card and confirming your identity through the video camera. Telecare consults are an option for people wary of visiting hospitals in a pandemic. Then in order to reduce the risk of cluster infections, the residential institutions such as nursing home and hospitals prohibited visitors. The family members and caregivers could only interact with their patient through a video visit. It would be a big challenge for the elderly with relatively poor cognitive function and disabilities to accept video calls. Institutions put more effort into adapting the elderly to this new interactive way. The patients were separated but not isolated. This could effectively reduce the anxiety of the cases and their family members. Warmth and love never stopped under the pandemic. 2 months after the level 3 epidemic alert, most elderly were at home all day long, watching TV, sitting on the chair, lying on the bed, and do nothing. We found that up to 65% of the elderly deteriorated physically and mentally, and the caregiver burden had significantly increased to these caregivers. So we try to use the digital technology for online and in-house training. We use innovative AI machine learning all-in-one model for home training. We could online prescribe and adapt the frequency, duration, and intensity of the training program, and record the training data of each domain for each person. The machine would help to analyze the strengths and weaknesses of the muscle power and cognitive ability, providing the next stage of training plan. We also introduce home ICT training programs. Through Family Sports app for Android TV, cable TV digital set-top box, Bluetooth sensor gloves, the elderly could easily join the program by operating the TV. We successfully let the aging population exercise efficiently and happily at home, preventing frailty and delayed cognitive decline. Changhua Christian Hospital also integrated traditional Chinese medicine into dementia care and pandemic prevention. In dementia delay intervention, including acupuncture, Chinese herb meals, tea, and health education, sitting Tai Chi, 八段锦 exercise, and so on. Traditional Chinese medicine in COVID-19 treatment, the clinical trial results show decreased the related symptoms of COVID-19, stopped the deterioration, shortened the length of hospital stay, and prevented pulmonary fibrosis. Besides, CCH also developed Chinese herb tea with comprehensive ingredients to boost your immunity to combat the pandemic. Now, Taiwan has reached around 80% vaccinated rate and 66% completed vaccinated. The epidemic alert would be downgraded to level 1 sooner. The elderly people with completed vaccinated come back to the community units again. However, we could no more see their smile under the mask. We don't know when the pandemic will be ended. A new lifestyle and care model are just begun. Thank you for your listening.